Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my channel. So now we will be going to discuss the introduction to anatomy. As we all know that anatomy is the basic subject for learning the medical sciences. So we should have some basic terminologies and the hold of basic concepts of anatomy. So let's start. The learning objective of this presentation will be that we should be able to define anatomy. We should be able to demonstrate the anatomical position. We should explain the anatomical planes. We should describe the anatomical sections. And we should discuss the anatomical terms of relationship. Now, what is anatomy? Anatomy is the basically the structural study of the body. It is the study of the structure of the body and the structures within the body. Okay? The human anatomy is divided into three separate fields. The macroscopic anatomy or the gross anatomy, the microscopic anatomy or histology, and the developmental anatomy or the embryology. The macroscopic anatomy deals with gross features which can be seen with the naked eye. For example, our hands, our face, head, neck, upper limb, lower limb, thorax, abdomen, the internal organs, lungs, liver, etc. etc. And the microscopic anatomy or the histology deals with the microscopic features which can only be seen with the microscope. Okay, the cells, the nucleus, the cytoplasm, the tissues, the epithelial tissue, the muscular tissue, the nervous tissue, the connective tissue, etc. etc. comes under the histology. And the developmental anatomy or the embryology deals with the developmental features of the human body. And it highlights the growth, the differentiation, the signaling, and the apoptosis. Now, this picture describes the gross anatomy. We can see the gross appearance of the liver, the large intestine, the small intestine, etc. The whole abdomen can be seen in this picture of gross anatomy. Histology, as we can see, it is dealing with the tissue structure. The tissue can be seen as an arrangement of cells, the nucleus and cytoplasm, the layers of cells, etc. And embryology is dealing with the developmental aspects of the body, the growth and differentiation. You can see the here is a fetus, the fetus connected with the placenta and umbilical cord and the yolk sac. Now, the anatomical positions. Now, there are basically three positions to study anatomy: the anatomical position, the prone position, and the supine position. Anatomical position is attained by standing erect, facing forwards, upper limbs by the side, the palms should face forward, this aspect of our hand should face forward, and the lower limbs together with toes facing forwards. The person should be erect, the face should be forwards, the upper limbs by the side, the palm should be forwards, the lower limbs by the side together, and the toe should be forward. The prone position. The prone position is attained by lying downwards. Face should be towards the platform and the palms should be upwards. The person should lie downwards. It should face towards the platform or the earth, and his palm should be upwards. It is the key point. The palm should be upwards and the face should be downwards. Prone has O and N with it. So O and N also come in down. The person is downward facing. Person is downward facing in the prone position. Supine position is attained by lying downwards, same as the prone position, but the face should be upwards and the palm should be facing the platform. Okay, so in supine position, the person should be lying downwards, but his face is upwards and the palm should face the earth. Supine has U and P in it, and U and P are meaning up, so the person is facing upwards. Now the anatomical planes. These are those axes of division which help us to study the anatomic detail, the structural details of an individual. The major anatomical planes are the median plane, the sagittal plane, the coronal plane, and the transverse plane. Now the median plane. The median plane is an axis through which the body can be divided into two equal halves. As we have studied in the previous class that humans are also they are belonging to the kingdom Animalia, and they are bilaterally symmetrical chordates. So the human body is also divisible into two equal halves by a line passing through the main axis. So the human body has a median plane going from the topmost point of the head, that is the vertex somewhere here, and to the coccyx bone, which is the last bone of the vertebral column somewhere here. So the median plane divides the body or any part of the body into two equal halves. This is the keyword, two equal halves. Is also the median plane is also called as the mid-sagittal plane or the midline. Okay, look at the image. There is the median plane, which is from the vertex to the coccyx bone and is dividing our body into a left part and a right part. Okay. Our limbs should can also be divided into equal halves by a median plane of themselves. The median plane of our hand is here, which is dividing our hand into right equal half and the left equal half. Okay. The sagittal plane is a plane which is a medial, is parallel to the median plane. Any plane which is parallel to the median plane is the sagittal plane. The median plane and the sagittal plane are both vertical planes, as we can see. Okay. So the sagittal plane, look at the image. The sagittal plane is plane parallel to the median plane. It is the median plane, and here is the sagittal plane. Okay. But it will not divide the body into two equal halves. Okay. Sagittal planes are made of two main types. One is the parasagittal plane, which is shown here. It is the same, the parallel to the median plane, and the other is mid sagittal plane. And we have discussed before that the mid sagittal plane is any plane which is from the vertex to the coccyx bone. So here is the mid sagittal plane or the midline. So the mid sagittal plane is also a type of sagittal plane, and it is same as the median plane. Next, the frontal plane. The frontal plane is the plane which divides the body into anterior and posterior parts. Okay, it is also called the coronal plane. The frontal plane is perpendicular to the median plane. As the median plane is from vertex to the coccyx, it is perpendicular to the frontal plane. Here is the median plane, and here is the frontal plane. So median plane is perpendicular to the frontal plane, or the frontal plane is perpendicular to the median plane. It is the same. Now, the anterior part is also referred to as the ventral part or volar part, and the posterior part is referred to as the dorsal part. Okay, it will be discussed later. The transverse plane, the plane which divides the body into a superior part or the cranial part, which is closer to the skull, and an inferior part or caudal part which is closer to the toes, is called as a transverse plane. Any plane which is dividing the body into superior part or the part closer to the skull and inferior part or part closer to the toes is the transverse plane. It is also called as the horizontal plane. This plane goes perpendicular to the median plane, sagittal plane, and the frontal plane. Let me show you. Here is the median plane. Sorry. Here is the median plane, and here is the frontal plane. See, and here is the transverse plane. It is perpendicular to both of them. To both the median and the frontal plane, and as well as to the sagittal plane, as the sagittal plane is parallel to the median plane, so it will also be perpendicular. The transverse plane could also be perpendicular to the sagittal plane. Okay, the radiologists, the doctors which do the who do the CT scan, the X-rays, and the MRIs, etc., use the word transaxial for the transverse plane in their practice field. Okay. Now the anatomical sections. Anatomical sections are the sections obtained by cutting the body or the parts of the human body in reference to the anatomical planes, which are, we have studied the median plane, the sagittal plane, the coronal plane, and the transverse plane. So there are three basic anatomical sections: the transverse section, the longitudinal section, and the coronal section. The transverse section. The transverse section is obtained by cutting the body or the part of the body in the transverse plane, as the word indicates. It is also referred to as cross section. Okay, it is section by which is obtained by cutting the body in the horizontal plane. Look at the image. We have a transverse section or the cross section of our upper limb. Here is the arm bone, the humerus. Here is the musculature. Here are the arteries, veins, and nerves, and here the skin. So it is the cross section. It is a transverse section. Next, the longitudinal section. The longitudinal section is obtained by cutting the body or parts of the body in a median plane or a sagittal plane. See, it is obtained by cutting the body in a vertical plane. You can look in the image. It is the median. It is the section, is the longitudinal section of our finger. Here are the bones. Here are the joints, and here are the associated ligaments, and here the skin. So it is a vertical section or a longitudinal section. Coronal section. The coronal section is a section of the body or a part of the body obtained by cutting the body in the coronal plane. Here we can see it is a coronal section of our hand. Here are the bones of the forearm, the carpals and the metacarpals, associated joints, the associated ligaments and connective tissues. And here is the coronal section.